So I was talking about some of the things we're going to cover this afternoon. We're also, I'm sure, going to cover stigma and what a huge obstacle, as we all know, it can be in terms of getting the help that we want and also leaning in and offering help. A lack of trust and shame can make those help-seeking behaviours even harder, and addressing this duality requires careful consideration of the many factors contributing to suicidal ideation and the barriers that prevent people from seeking help. Today, we're going to consider some of those risk factors. We'll look at the Talking Faith in Suicide Prevention online resource and how to understand the complex relationship between the different faiths and suicide prevention. I hope, this is obviously a very short talk, but I hope it will leave you feeling more confident around having conversations in terms of faith and spirituality within your prevention work and where it's appropriate to use, and understand how much we can lean into that deep meaning that others find useful in their moment of crisis. So let me introduce you to our panel, if I can get my slides to move, and they're being particularly tricky at the moment. There we go. Lovely. So our panel today, we're joined by the wonderful Sandeep Saib, who has lived and living experience as a mental health advocate. Jeremy Simmons, who's the Policy and Programmes Manager for Faith in Action. Mariana, Public Health Officer at Westminster City Council and Royal Borough of Kensington and Chelsea. Welcome to our panel. We're also joined by Kieran. Kieran has been volunteering for Ollie since he was 17, but he's now a qualified mental health nurse working in inpatient facilities. And Kieran has been someone who has really helped focus and champion some of the understanding and work that the Ollie Foundation does in terms of leaning in to faith and spirituality where it's appropriate within intervention and prevention. Now, Jo, our colleague, is also here. She's supporting with the IT. She's letting you in and out of the room if your Wi-Fi drops out, and she'll be supporting us all in monitoring any questions that come in. So I'm going to invite you, if you haven't already, to pop yourself on mute. Jo will be helping make sure that happens for everyone as well. You do not have to have your video on, although it's delightful to see your faces, but that's not necessary, but we enjoy seeing who's in the room. Jo and my colleagues here today are going to help populate the chat with information that might be useful or extend something that we've said while speaking. So it could be things like links or books or websites. And I deeply respect and honour all the knowledge that's in the room as within you, our delegates. So please also feel free to populate the chat with all the information that feels useful to share, whether it's websites, books, support groups, things that are going to support and help share knowledge, disseminate knowledge within the group today. We will then compile all of that and pop it into a resource document that will go out to you in the next few days. Now, you can activate closed captions by clicking that link that's just lit up. It won't interfere with anyone else's screen, and it will stop at the end of this session. But if it is useful for you to read as well as listen to what's being said today, then please feel free to do that. Before we go any further, I also want to introduce you to Ollie, because you might not have ever heard of us before. We are a suicide prevention charity. We're based in Hertfordshire, but we operate across the country, and we were set up by the three people you see on the screen next to me: Stuart, Jane and Chris, all parents who lost a son to suicide. They met in bereavement support, and they vowed to do everything they could to stop anyone else going through the pain they experienced and frankly continue to experience. Today, the Ollie Foundation provides a range of training suitable for children in primary school all the way through to supporting professionals, CAMs, teachers. We run panel events like the one we're on today, and most of those can be found, the recordings of those can be found on our YouTube channel. There's a whole range of talks from child on parent violence to the trauma of relinquishment. There's a whole range of interesting talks there, so please have a look at those when you have time. And this talk is being recorded and will also be added to that that list of lovely talks on YouTube that you can enjoy. We collaborate with partners, we signpost professionals and the public to the support they need. We share best practice, and we like to think that we contribute to that best practice too. And every year we engage and train around 5,000 people. And we're so delighted that you can be with us here today, because as our name reminds us all, one life lost is enough. If you go onto our website that looks like this, you will see, if you click on what we do and then training, you will get to what's on, and you will see all the things that we have coming up. Everything that's listed there is either heavily subsidized that's in relation to the assist training, but everything else is free access. We do make space for you to give a donation with anything that's within your gift, but it's not necessary. And for anyone that did contribute to being here today, can I say thank you, because we don't receive statutory funding, and to deliver the wide range of training that we do to the public and to professionals, we need support. So thank you in advance. But also, it's not a problem if you didn't, and you can join any of our sessions, from our Zentangle, which is a mindful art session, to our open mindful Pilates session, to our other talks that really get into the nature of suicide prevention and intervention. So I just mentioned, I think my next slide coming up, oh no, let me go here. Just quickly before we get into our talk today, I want to just do a little plug for some work that we are starting next month in April. So due to some very generous funding that we received, we are able to offer a year's worth of training and support. All the sessions that we offer, plus our Pilates and art classes, particularly for nurses, but for all NHS staff. If that's you, or you know somebody that this would be useful to, please let them know. All the information will be on our website, or they can contact Jo or myself. And we have lots of resources on our website. Lots of free downloads, including our prescription safe plan, a safe plan, and the other things you see on the screen. Very happy to send you the information if it's relevant, but I don't want to take up any more time today. So let me hand over to our colleagues, and let's get going with Talking Faith in Suicide Prevention. So I want first of all to hand over to Mariana and the rest of the panel to introduce themselves and share anything else that feels relevant before we get into your talk. Thank you, Mariana.
Thank you so much, Debbie. My name is Mariana Covalenco. I'm a public health officer at Westminster City Council in the Royal Borough of Kensington and Chelsea, and I support the mental health agenda. I'll hand over to Jeremy.
Thank you. Hi, everyone. Really, really good to be here. My name's Jeremy Simmons. I'm Policy and Programme Manager at Faith Action. We are passionate about empowering faith-based organisations to make a difference to their communities, and we work in a range of different project areas. But yeah, talking today about our work around suicide prevention. Sandeep?
Thanks, Jeremy. Thanks, Mariana. And thanks, Debbie and the Ollie Foundation team. Morning, everybody, or afternoon, shall I say. I'm Sandeep Saib. I'm a lived and experienced mental health advocate, and I've survived attempted suicide. And it's just a pleasure to be here today and share the platform with my colleagues to talk about this resource, Talking Faith in Suicide Prevention. So thank you very much for having me. I'll pass it on to Mariana.
Yep. Apologies, haven't used Zoom in a while. So let me know if you can see my slides.
Yes, yeah.
We can. Do you want to put them in presenter mode though, so they're on full screen? Thanks, Mariana.
Yep. Can everyone see them now?
They're not yet on full screen.
Just
there we go. There we go. Perfect. Thank you.
Thank you so much. Good afternoon to everyone once again, and thank you so much to Oli Foundation team for inviting us today to talk about the new Talking Faith and Suicide Prevention resource. But just before we start, I wanted to give you an insight on how we got here. So in the last years, we have been commissioning Every Life Matters, a Cambrian organization, to deliver suicide prevention training. And 5 years ago, in 2020, we engaged with our communities, and the feedback highlighted that diversity was not reflected in our training. And the Suicide Safer Communities training offer was put out to tender and reviewed. Fast forwarding in 2022, we had another engagement with our communities, charities, and frontline services to explore how suicide awareness training could be enhanced to consider the diverse communities in both Kensington, Chelsea, and in Westminster. Around the time when I joined the public health team back in March in 2023, we reached out to Jeremy from Faith Action, Thrive London, and Good Thinking, and chairs of faith groups and experts by experience, to see if we could potentially have another engagement to see what else is needed in this space. In April, we had our first engagement, our workshop with representatives of different faiths, with people with lived experience, frontline services, blue light services. And then fast forwarding in the summer, Faith Action led on another workshop with representatives of 6 faiths to get more feedback. And after that engagement, to build up this new resource. I've got some data from ONS. This is the latest data that links suicide prevention and religion from ONS. And on this slide, you will see data that suicide rates and how they are linked with religious affiliation. The data highlights the fact that faith is considered as a protective factor compared with those who identify with no religion. The lowest rates of suicide were those who identified as Muslim, and rates of suicide were highest for those who identified as Buddhist. For men and for women, the rates of suicide were lower across Muslim, Hindu, Jewish, Christian, and Sikh groups compared with the group who reported no religion. However, as all data, there are a few limitations that I wanted to highlight. And the first one is that coroner's judgments can be affected by faith, therefore not all information will be disclosed. And the second limitation around this data is that families might not wish to disclose their faith. In our suicide prevention work, the message is simple. Suicide and bereavement by suicide can affect anyone at any point or transition in their life. And there may be many suicidal feelings, and this could be linked with pregnancy, childbirth, cultural pressures, society's expectations, the cost of living, history of conflict in the family. And it's also necessary to highlight that there are community groups that are at risk, that are at high risk. And from these, we know that there are men, children, young people, people who are socially isolated, who might be lonely, the LGBTQIA+ community, people impacted financially through loss of employment with impact on mental wellness. We engage with all our communities in Westminster and RBKC in the last few years, and one theme kept coming up, and that was that faith plays an important role in preventing suicide. From our last engagement back in April 2023, there were a few themes that we've identified. I've highlighted a few of them. One of them was around misconceptions about suicide, that there are myths that exist in all faiths, and that scriptures can help break down these misconceptions, that faith is a protective factor, and it's quite important to emphasize the relationship between physical and spiritual well-being, and that the community support is vital. That we also have to work around supporting individuals at risk through collaboration, through suicide prevention training, and using scriptures that can reduce the stigma around suicide. We've also identified that there are many barriers to services, and that could be associated with stigma. There could also be cultural barriers, language barriers, and lack of awareness. Through all our engagement, it was also emphasized the fact that it's important to come back to communities with valuable information, so providing data on suicide impacts, on training uptake, and have culturally competent resources. And when we had a conversation around what could be helpful, and if we would build a resource, how that would look like, we had feedback around having more awareness around community services to create safe spaces for everyone to go and talk about their feelings, and also have support through campaigns. And now I will hand over to Jeremy.
Thank you, Mariana. So I'm going to just give a bit of an overview now of the resource which we developed, building on the work that Mariana just described with the public health team at Westminster City Council and Kensington and Chelsea. So this resource was co-produced between us, including Sandeep's involvement, which she'll talk about in a minute. But I just wanted to give a kind of deep dive into what the resource is, what it looks like, how it works, and what you need to know about it. We decided, building again on the work that Mariana and her team had done, that a good next step would be to develop a tool really on this role of faith and belief in suicide prevention conversations. We identified a key audience for this tool as frontline workers, and really what we meant by that was anybody in a professional capacity who may be interacting with patients or the public, and may engage in conversations around suicide prevention. So anyone that might be having a conversation with someone where that theme comes up, and they might want to feel empowered around how to think about faith in the context of that conversation. So we developed the content for it through a series of one-to-one interviews with faith leaders from 6 different traditions. And we held 2 large workshops. So one really about listening and hearing experiences and themes, and then a co-production design workshop, which is really about thinking, how do we make this practical? What does a resource need to contain? How does it need to work? And then we developed it with an expert panel and had lots of kind of editing and revision of content through the summer to autumn of 2023. So moving to the next slide then, we can see that this kind of section of the resource, which we called 8 themes around suicide prevention, really goes into detail on some of the themes that came up from those workshops and when we spoke to people. You can see the kind of the list of themes across the top there. There were kind of 8 particular themes. But I think something cutting through all of them was this awareness that was touched on really at the beginning of this session, actually, that when it comes to faith and suicide prevention, it's a very complex picture. And it's this reality that there are resources within faith communities that really can support with suicide prevention, but there are also challenges. And actually, often the very things that might help for one person may hinder for someone else. And it's really this nuance that we wanted to capture. A really vivid example of that, and you can see it on the screen at the moment, and we heard this multiple times when we were engaging with people, was this theme around community. So for one person, being part of a supportive faith community may be exactly the thing that they need to get through the challenges that life throws at them. You know, that sense of belonging, the shared purpose, the care and compassion that's often present within faith communities. But for someone else, it might present a challenge. You know, there might be that sense of feeling like you're in a goldfish bowl, that everybody knows your business, what's going on. It might cause people to withdraw, or even have that kind of chilling effect that people don't want to open up and talk about what they're going through. And we didn't want to kind of paint this simplistic picture that we need to consider faith. You know, faith is, you know, it's simple. We just need to talk more about faith. We wanted to reflect that actually there can be a challenge, but let's take a nuanced approach to this and recognize that everyone's experience is different, but really provide just a bit of information to empower people in beginning to have those conversations. So for each of these themes, whether it's community or bereavement and things like that, we tried to draw out that nuance, and we've included testimonials, quotes and experiences throughout as well, really reflecting that lived experience perspective. We really do encourage you. There's a lot more to this resource than I'm able to talk about right now, so do please have a look at it and navigate it yourself. Come back to us with any questions. We really do want this to be a living document that can be amended and improved over time. Just moving on then to look at the faith-specific pages. Really at the core of this resource are 6 different pages that look at 6 different faiths. So you can see in front of you our section on Islam. You can see that there are some texts across the top, some scriptures that really speak to these themes around suicide prevention, life, death, suffering, etc. And you can also see the key navigation, which is divided into snapshot, support, and then additional content. And I just wanted to say that we did develop this content with representatives of different faith traditions, but we really, really want to acknowledge just a huge diversity of viewpoints within different faiths. We recognize that no faith tradition is completely homogenous and you know, completely the same in beliefs and thinking around this. And we tried to strike that balance, and it was challenging at times, but providing enough detail to be informative. So it's not so generic that it's meaningless, but there's enough detail to inform without straying too much into issues of great debate within faith traditions. So this really isn't a comprehensive faith literacy resource. But it's really just asking, how might someone from that particular faith see the world, and where and how might they access support if they're going through challenges, if they're experiencing suicidal ideation, and kind of want to integrate faith in terms of that approach. So that first section, snapshot, is really about giving a brief overview of how someone might view life, suffering, and death. The support section really asks the question, where do people from this faith tend to gather and connect? What are their rhythms of worship? Are there particular festivals which might be worth bearing in mind? And then finally, in some ways, most importantly, we include lots of links to resources and additional content. There are so many great organizations working at the intersection of faith, mental health, and suicide prevention, and we wanted to signpost to as many of these as possible. So do please take a look at those. So really just drawing to a close and finishing up, I think it's just really important to, again, emphasize that this is meant to be a primer. This is not a comprehensive resource on everything you need to know about suicide prevention. It should be accompanied with standard training on suicide prevention as well as faith literacy. But really, we do hope it gives a bit of information just to empower those frontline workers to start to think about faith and start to think about perhaps the person in front of them, and what open questions can they ask to bring that aspect of identity into the conversation. So do check it out, have a look, and yeah, if there's any thoughts or questions or suggestions, do please get in touch with me at Faith Action as well. I'm going to hand over now to Sandeep just to give a bit of a reflection on her own experience and involvement in this work.
Thank you so much, Jeremy and Mariana. Really appreciate that. So for me, I come at it as a person with living experience of mental health, as a survivor of attempted suicide. So before we delve into this segment here, where I share my thoughts and experience in being part of this resource, I just wanted to go back slightly just to give you a snapshot of my journey and where I am today. So I was diagnosed with anorexia nervosa, body dysmorphic disorder, and obsessive compulsive disorder back in 2012. 2014, on the 29th of August, is where I tried to take my own life. Since 2016, that's where I started my journey to recovery, to support, and faced many challenges, faced many roadblocks, and I felt that there was the two big F's of support pillars in my life: family and faith. Those are the two big F's for me. And reflecting upon that, where I tried to take my own life was in my own place of worship. I'm from a Sikh background, and I tried to take my own life in the Gurdwara, our place of worship. So to say that I'm a believer that things happen for a reason could be said from one side of things. On the other side, it's a case where it has really brought me closer to my faith. When I was struggling, when I was suffering, I was thinking very tunnel vision. I was holding myself to blame, holding myself to accountable, moving further and further away from my faith, from my family, for those areas of my life where I held value, and became my own. And that monster consumed me and chipped away at me. So those two big F's have been my huge support pillars until this very day. I'm pleased to say that I'm ever more close to my faith and my family. So fast forward to the present day, I had the opportunity to support many charities in various different capacities. One particular association is the National Suicide Prevention Alliance, where I joined the community there as a lived experience influencer. As part of one of the involvement opportunities was in fact this resource. It spoke to me for so many reasons that Jeremy and Mariana kindly alluded to. I got on board and shared my perspectives and my opinions, and really felt that I was seen, heard, and respected. And for me, being a voice to contribute to a resource like this speaks volumes. And yes, it may not be the answer for everything, but it is a starting point. It is a kite mark, a first of its kind. So I had the privilege of supporting the Sikh faith group. To say that it's a prevalent issue in the Sikh faith and faith groups in general, yes, it is still very much a key challenging area to navigate. It's so important to understand first and foremost that faith, spiritual practices, religious communities, as Jeremy alluded to, do often provide emotional support, understanding, a sense of belonging, which can be protective factors against feeling of despair, of isolation. So having a community that you can speak to, that you can trust, that you can build that close relationship with is so important, especially those that are faith-led and that strong aspect of who they are. Now, on that point of who they are, it's so important to look at the individual as a whole rather than the sum of their parts. That is absolutely crucial to maintain and understand. You really need to understand the person, the human that is in front of you, and give them the benefit of the doubt. Just listen to them. Give them that safe space. Having this resource, for example, is a great conversation starter. Yes, not everyone will have a particular faith group that they believe or they adhere to. So be open-minded with that. Give them that space, give them that time to kind of open up and see where they're at. reach them to where they're at, definitely. So the power of faith for me till this very day has been very, very crucial. And I've just been honoured, and it's just been a pleasure and a journey to work on this resource. It is there to be used. And as Jeremy alluded to, it's a live document, which is always looking to enhance itself and looking to improve, because faith groups are constantly evolving. I've picked up the other day from my temple, I'm not sure if you can see this, I just don't know if you can see that, but it is a let me just blur my background. Don't know if you can see that. Sikh therapy that I found in a Gurdwara, and this is the reverse, gives you a snapshot. So this is a prime example of how faith groups are doing so much more to tackle not just suicide in general, but also mental health and well-being. They are actually much more proactive than I say in the last five to 10 years. And maybe it's perhaps to do with the lockdown, or hearing and seeing mental health being more talked about and normalized. So it's important for us to keep on that trajectory as much as we can. And if there has to be anything in terms of key takeaways from me, is number one, there needs to be no wrong door to access support for individuals. It needs to be inclusive, and they need to be heard, seen, and respected. And that care must be person-centered. Person-centric is absolutely crucial. We need to foster collaboration. We need to prioritize inclusion. We need to raise much more awareness and building and instilling confidence. You know, I'm hearing on a numerous accounts where stakeholders and charities and healthcare professionals know what the what is, but it is the how. How do we implement support to make it much more person-centric, the support that they are providing and supporting the workforce? But above all, it's having people with lived experience, expert by experience, having their voices heard at every seat of every table. So I am just one voice, as I mentioned, absolutely privileged and honoured to support this resource. And I just want to leave it there and hand the mic over to Debbie. Thank you so much.
Thank you so much. Maybe what I will do is just pin myself, but also Kieran, who I want to bring into the conversation. So thank you, everybody. And just a gentle reminder to all our wonderful delegates that now is a great opportunity. If you have any questions, if you want to pop them in the chat or raise your hand, popping in the chat would be great. Mariana, thank you. So important. You started us off this afternoon with this incredible model of how we can be more inclusive, and I really appreciate that. So thank you for talking us through that timeline. My goodness, Sandeep, I think it's something that we have probably, many people in this room have been saying for a long time: no wrong door, person-centric. Thank you so much for reminding us of that. It is key, isn't it? I'd just also like to say it's so nice to see, you know, you spoke about faith and family, and I just want to give a shout out to everyone who's taken the time to be here this lunchtime. But I see so many of the suicide prevention family here in the audience, and it's really wonderful to see you here supporting and learning from our wonderful delegates. I think there are misconceptions. We spoke about misconceptions, didn't we? And I think that's true even in healthcare. It's true wherever we look, there are misconceptions, and that's something that Ollie and many of my extended family in our delegates today seek to challenge, seek to educate and support and explore. Really support people to be curious about those ideas, where they came from. And if anyone would like to join us on the 24th, we will be running our History of Suicide talk, which doesn't focus so much on religion, but of course it does, because religion created many of our laws, and we explore how some of the laws that we have had in our history have really influenced where we are today in terms of policy and provision. So I think that's probably enough from me in sort of a thanks and a summary. And I want to, Kieran, I want to hear if you have any thoughts based on what you said, but also Joe, do we have any questions that you've picked up that you'd like to ask the panel?
Just one from Julie saying that is it okay to share this resource with contacts who will find it useful?
Yes,
Yeah.
everyone
Great.
is saying absolutely. Please
Thank
do
you.
that. You want this shared as widely as possible, right? This is a living document, so I'm guessing you also want people to reach out to you and share anything that they feel would be useful for you.
Yes, please. Yeah, there's if you go onto the resource, there's a little speech bubble in the corner, which if you click, it should let you quickly send a message to the team. So that's quite a handy way of doing it if you want to provide feedback.
Oh, thank you, Jeremy. Kieran, of course, you're working in inpatient facilities, and as I said at the top of this talk, you've been wonderful in helping us as a team thinking about how we lean in to spirituality and faith where it exists and use that in our safe plans, for instance. Is there anything that you'd like to share that you've experienced within your place of work, or just anything that you'd like to comment on?
Yeah, no, definitely. Thank you, Debbie. And again, thank you guys for your input. It's been incredibly helpful. And that resource is definitely something I can bring to my own personal work as well. But I guess, like I said, so I'm a registered mental health nurse. I've worked in psychiatric intensive care unit and also in crisis teams, CAMS care everywhere across the board. So I think from my experience, faith can be so symbiotic to someone's presentation, especially within their illness, and especially with the like a nursing model of care is so holistic, but a lot of the times that spirituality and faith is something that's missed. And what I found to be super effective is, I guess, going into that angle of their belief, their whatever is being presented, alongside their faith or their spiritual beliefs, and that's usually a key point in someone's recovery for their own kind of benefit, and also for a care team to be able to really reach them. And like we were talking about, these communities, like you say, Mariana, that aren't as seen and their voices aren't heard as much, that very much translates into mental health services. So it's incredibly important we address this. And I think the resources you guys have made together is phenomenal, to be honest. It's something that I feel should be shared across the board. But yeah, I would say, like you asked me, Debbie, if there's anything specific. I've worked with individuals where elements of their faith become both protective in terms of their suicide, but again, something that they're struggling with, that they feel suicidal and they feel that they can't do it because of their faith, but that they want to escape in some way. And there's a lot of benefit in terms of kind of through chaplaincy and other services to address that. And like you said, Sandeep, this thing of tailored therapies for someone that actually understands your background, understands the culture within the faith itself, because there's so many nuances, and I think it's too broad to address things in its own unit. So yeah, but again, any other questions, I'm happy to put my tuppence in.
Debbie, you're muted, sorry.
Unmute, rookie mistake. Sorry, everyone. What I was mouthing and now saying out loud is moral injury. It's something we cover in some of our talks, and the connection there with our faith. So if that's something that's of interest to you, please do come on to our session Talk Safe. There is a question from Steve Phillips, who says it's for the panel, although it might be specifically something Jeremy wants to think about. In relation to suicide, when speaker to faith leaders, was there one common theme that came up consistently? Sorry, when speaking to faith leaders, was there one common theme that came up consistently which contributed to stigma and preventing more open dialogue taking place? And Mariana is also nodding there if you want to come in.
Sure, I think I've got the actual results from the engagement. And there are actually a couple. I can't really pinpoint to only one of them. But one thing linked with suicide is the fear that if you start to have a conversation about suicide, that you will encourage the person to think of taking their life. That was one of the common misconceptions. And there was a lot around shame, because suicide ideation sometimes is linked with shame and with different faiths. You know, some people have the misconception that you don't really have the right to suffer if you believe in a higher power or God. And there was also quite a lot of unawareness around what support there is, and specifically, I guess, cultural support. And I think there was around cultural sensitivity, which I think that Jeremy can talk about more, because we had really good insights from his engagement around that.
Thank you. Yeah, I mean, it's very hard to pinpoint one particular thing, because there were so many themes. And actually, I think, you know, even despite the diversity of faiths that we talk to, it's actually incredible how many cross-cutting themes there are across faith traditions. But I think, yeah, one thing that definitely did come through was that question around almost in some sense the elephant in the room in conversations around faith and suicide is that question of sinfulness. Like, is it something that's seen as sinful? And I think it was something that was, I think people found quite helpful to mention and talk about in the discussions, because often that can be the thing that causes people to just not want to go there, you know, in terms of faith. So I think it was helpful to hear reflections that actually so many faith traditions are on journeys of learning how to talk about these things. We heard Mariana touched on some of the cultural implications. We heard from some particular faiths and cultures that actually there maybe historically hasn't been language to talk about suicide within those cultures and within those faiths, but actually they do have language to talk about sort of emotional well-being more broadly. And so there can be all these assumptions and challenges that almost put up barriers in having these conversations. And I think actually just having the conversation really helped alleviate some of that. And it just made I certainly came away thinking we need to talk about this more, not less, and not sort of not let those fears create a chilling effect around faith, but actually just lean in and say it's okay to ask questions. It's okay to have open discussion, and take things further. But yeah, that would be a few things that stand out to me.
Thank you. Put my glasses back on to see Tanya the question.
Oh,
thanks, Joe. Do you want to read
I was
that?
actually going to go back to one that was previously,
okay.
Debbie, but just briefly, Jeremy, one delegate has asked, Suki's asked if there's any training that goes alongside the tool that is available. Sorry, excuse me.
Not as yet. No training at the moment. It's something we're very open to. I think, as always with these things, we're very much restricted a little bit by capacity and funding and things like that. So we're always looking for opportunities to kind of take this further. And I think we're also aware that there's a huge amount of engagement that we want to do with faith communities themselves around this, not just the sort of frontline workers, but actually facing the other way and talking to faith communities. So there's lots of ideas of where we might take this around training and further engagement, but not as yet.
Thank you. Sorry, Debbie, I'll hand back to you.
Oh, that's I know Sandeep, you wanted to come in. Please do.
Thank you so much, Debbie. I just wanted to add to what Jeremy and Mariana said in relation to the question regarding faith leaders. I think what I'm also, in addition to what they've mentioned here, I also think that training and development is also very, very key. Training up faith leaders in the world of mental health and suicide prevention, not just suicide prevention, but also mental health and well-being. So making them feel as confident as they can to support someone that is in distress. And if they do mention the word suicide, to stand by that and continue that conversation, or find the courage within them with the support of training. And then within that, have a buddy peer-to-peer support system within these faith groups as well. So faith leaders then train their relevant colleagues in the relevant places of worship to disseminate that information, to share it out. I think that's very important, training and development. And also another point is language. Language has come up time and time again that I'm seeing. That individuals that are of a faith background, English is a barrier for most of them. And most of our resources are in English. So it's considering how can we make them much more inclusive? How can we translate that? How can we even use things like AI and Copilot to do the hard work, to translate the current resources that we do have into their mother tongue, so it's easily digestible? So things like that, quick wins like that, can make a huge difference. So I just wanted to add that into the mix there.
Thank you, Sandeep. It's why we went to great lengths to make sure our prescription safe plan was available in 16 languages, and why our website, you can translate it into any language. But I know that's a cost, and I'm sure hopefully you can get some funding. If that's not already something on your website, you'll be able to do too, because like you say, it's vital. Tanya says, not necessarily a question, but more so to share that as someone who grew up in a multi-faith household, it can be difficult to navigate, especially where there can be conflicting narratives around suicide. These resources are really helpful, so thank you for creating them, and can be a great starting point for those navigating a multi-faith context. And Megan asks, and this might be something that is on the website or will be on it, but or within the resource, I mean, is there any guidance for caregivers on how to sensitively bring up and explore the topic of faith, and particularly thinking about non-judgmental language? Is there anything that you could speak to
Yeah,
help?
so there is actually a section on the resource around this. So if you go to the how section, that's really where we kind of collate all the best practice in having these kinds of conversations and how you might go about doing that. And that really was, again, talking to people a lot more experienced than us in doing that, and kind of pointing to those key bits of best practice. So it's things like letting the person lead, not over-identifying with people, even if you might be from a similar kind of faith background to them, admitting that everyone's experience is unique, moving from a sense of kind of needing to be culturally competent, which can be a barrier for some people, in thinking, I need to know everything there is to know about different cultures, otherwise I shouldn't say anything, to actually a position of cultural humility, and thinking actually the person in front of me is the expert, and I can learn from them without interrogating them, but just giving them that space. So there's some guidance there which might be helpful, but if there's anything missing, do let us know as well.
Well, Steve Phillips has very kindly shared in the chat some work that he highlights for all of us, carried out by Dr. Sandi Oni in Indonesia, and how reframing that conversation around sin, he had some success in that reframing by getting faith leaders to consider suicide prevention as a way of preventing a sin from being committed. So I'm just reading that out there. The link is there, Steve. Thank you so much for sharing that. What else is in the chat here? Kieran's put some links in. Thank you so much. Thank you, Suki. So Suki from Hertfordshire, where we're based, it's lovely to have you here. And Suki has said that a resource for carers has recently been produced, but it's not specific in terms of faith content, but it might be useful for carers. And although it's likely to be heart specific, I'm sure there'll be lots of information there that's relevant. Thank you, Suki. Oh, and you've put the link in there, so that's great. Thank you so much. Julie, you say that you feel like you could do with more training. We offer a whole range of training, and it's always free access. But there's lots of training, and there's lots of amazing organisations delivering training. And what I say to every one of our delegates, and I'll say it here today, is there is a lot that is free access, and it's good quality training. And I always recommend you do as much as you can do, that you have time for, because you'll get a nugget from everybody. And certainly if you want to know some of the other organisations that we recommend, we can send that to you. And as I say, we have a rolling programme of free sessions that are available online, so please make use of that. Somebody else, we have another note here. I think there's also a challenge in reaching out to people from South Asian communities, especially who come as immigrants to this country and not connected to faith and family in the same way as they would be back home. There has to be a way to tap into that demographic and make them aware that support is available. I know a case of suicide because the person couldn't deal with a personal issue, but despite sharing, didn't get directed to professional help. So in a way, making the general public also aware of signs and symptoms. Oh my gosh, Abda, that is really what we're all about. And I think that's what all of us, or so many of us here today, are trying to do. There never stops, it seems, the barrier to access. There is so much support out there, but it's making sure people know where it is and how to access it. Suki, is your hand still up, or is that a legacy hand?
It's a different point. If you're happy for me to come in. Thank you. Thank you, Debbie, and thank you for letting me share the carers resource. I'm hoping that that's something that people find useful. I just wanted to come in on, because I raised the question earlier in the chat, which I know has been picked up around training following this. So I work in public health within Hertfordshire County Council with Ma'am Marjan Khan, who I know you work with very closely as well, Debbie. You're part of a lot of the work that we've launched recently, so thank you for your support. So yeah, my role is in mental health and suicide prevention, and from a public health point of view, I think this is a fantastic resource, and it's something that we can definitely help to promote. Obviously, we're Hertfordshire specific. We do have members at a national level as well. We work really closely with an East of England lead for this area of work, who's connected through Department of Health and Social Care. So we can definitely link you in to promoting it on more of a national level. And then as part of that, I think we have some faith groups that are linked into the work that we do. So for example, locally in Hertfordshire, through the work that we do, we could definitely promote the tool and work with our faith partners. We did used to have a suicide prevention training offer for frontline workers and people from VCSFE organisations that would have been able to access that training to complement the tool. Unfortunately, as is the case in many parts of the country, funding is not there as much as it used to be. So we have to look at how we can access that support. So through our channels, we can promote the training that is available, that we know exists, but it's also about thinking, okay, is there anything else that's needed in this space? And we can take that on board and look at that as much as we can. And I just wanted to ask Jeremy, I think this question is probably for you. I'm looking at the tool that you presented. Do you have links in there to training that is available, like either at a national level, for example, something that Samaritans might offer, something that Ollie Foundation might offer, but also, for example, the leaflet that Sandeep held up, Finding Sick Therapy, are those all linked in the tool? And apologies if you've already covered that.
Yeah, no, thanks for that. We do, so pretty much everything we could find around faith and suicide prevention, as well as more general suicide prevention advice and guidance, we try to link to in the resource. Having said that, I know there must be things missing. So please do tell us what is missing. I think in terms of specific training, to my knowledge, there isn't anything that specifically addresses faith and suicide prevention as a subject matter in itself. I could be wrong with that. But that might be a little gap there in terms of something to plug. But in terms of other training, yeah, that should be covered in the resource. Yeah,
and support as well, I think. Yeah, so
exactly.
I can definitely and I can copy you in, Debbie, if you want to copy others in, that's fine. I can send an email to our East of England lead, who can, like I said, connect at more of a national level. And I'm wondering if there is a there is a list somewhere that somebody hopefully was managing, and if there's not, if it would be an opportunity to do that, and then we can all add to that and ideally keep it updated so that there is. I think that'd be really good to have almost like a portal of what's available, because a lot of the time we have some fantastic local knowledge, and it's about, I think, sharing it out that other people can access it, because especially because of funding cuts. So yeah, just wanted to share that. But thank you, today's been really useful.
Oh, thank you for that. It's so lovely. So here we've got partnership and collaboration in action. That's incredible. And Jacqueline shares that Living Works offer a Living Works Faith online course, which Jacqueline says is great. So do check that out.
Thank you.
Well, as we are coming up to the hour, I just want to thank everyone for their time. You have another moment if you have any more questions, but while I let you think about that, I just want to remind everyone that I feel like we're all safe right now. You all look like you're in places where you feel safe and comfortable. But if anything has come up today, if we've left you with more questions than answers, please reach out. You definitely have Jo's contact details because she's been emailing you all with the link. You are now introduced to all our panelists, and you know how to contact them, but you're part of the now ever-growing Ollie delegate family, and we will always be here to support you. I want to remind you of the support that's available in your personal network, but also all the national support that's available. And if you're unsure what that looks like, please have a look at our website or any number of other websites that will signpost you. Scott, I see you've got your hand up, so come on in.
Typing is a challenge because the NHS provided me with a laptop that sometimes works.
Okay.
Good afternoon. It's lovely to see you all. My name's Scott and I am, I suppose, head of faith and spiritual wellbeing at the East of England Ambulance Service. We cover a large area. It's a big title, I'm just a small man. I think for us, I would be very interested for people to reach out to me, and please do, because this tool I'm going to shamelessly put on our East24 portal, which is available for all of our staff, both frontline and non-frontline operational staff as well. I don't know if I need permission from someone to do that because there is 6,500 people who work for our organisation. So, we are currently having some critical conversations. I not long ago took over the multi-faith network, and I'd be really interested for anyone on the call to reach out to me for any ideas, because we didn't get it right. I'm sure the leaders won't thank me for that, but you know, especially with suicide and faith, as an organisation, we really need to be brave and start talking about it, and we need to ask people, you know, into sessions and challenge people on their on what they believe, as in people of no faith coming in and not understanding the importance that faith plays in their patients' lives. So this is a bit of a shameless plug for me, really, because I would love for people to reach out. Collaboration is wonderful, and I can't do it by myself. But I think now with the ambulance service and other frontline being given most mental health, you know, the police love them. They generally will pass it over to us, which is wonderful. We are there to care for people, and we love seeing people wherever they are. But the more help I can give my people and me in helping our people, I would be really grateful for. And it's lovely to meet you all. Please invite me back. I will make it when I can.
Thank you, Scott. And Scott, I'm going to reach out to you very quickly, because that year's programme for nurses is also for our ambulance crews, our first responders, our paramedics. And we work very closely with a colleague of yours, Jo, the paddling paramedic. You probably know who I'm talking about. So it'd be lovely to speak to you and see how we can support. And I'm sure everyone else on the call is making a note of your name. And if you want to put your email in the chat, that might be helpful for people. Yes, there you go. You've already got people asking for your contact details, Scott. You have opened a door, which is delightful. Kieran, we really need to wrap up now, so maybe you're going to end up with the last word.
Sorry, it was just a quick one, I guess, coming off Scott's point that I guess, yeah, reiterating the need for cultural competency within care, with frontline services, and even without that, within, like we were saying, with community leaders, that just a start of understanding is such a significant change that we can make And I think from that, like you said, Scott, it will be completely institutional to change how we deliver care, how we connect with other people, and recognizing faith as being important, not pushing it to the side.
Thank you. Well, that does feel like the last word, and a really important words. Thank you, Jeremy, Mariana, Sandeep, thank you so much. Thank you, Kieran, and thank you, Scott, and everyone who's contributed. We will collate everything that's put in the chat and send it out to you in a resource document in the next few days. And if you have any questions before that, please do get in touch. I'm going to leave you all to hopefully get on with also a beautiful day wherever you are. It's lovely where I'm based today. And yeah, I'll let you gently leave the room. Our panelists might stay on for a minute. It would be lovely to thank you outside of the actual talk. But thank you, everyone. Thank you, and see you again, I hope, soon. Bye, Francois. Thank you for being here.
Yeah. Thank you, and bye-bye.
Bye-bye. Thank you.
Thank you very much, Debbie. Thank you.
Thank you for being here. We really appreciate your time.
Thank
We definitely can be more than the sum of our parts, can't we? And just the collaboration I can already see happening. Thank you for sharing in the chat, and thank you for everything that you've offered. Scott, you're going to get lots of emails, I'm guessing. Yeah, all good. Well, we're rapidly going down in numbers, Joe, but maybe you can help move people into the waiting room. Unless anyone has any more questions. Lucy, can we email you? I know you said you'd like to know more information about training.
Yeah, that would be amazing. Yes, thank you.
Yeah, so before we let you go, Lucy had a question about doing training or learning more and understanding more about how she can help young people. Are you thinking more primary or secondary?
So it's more that kind of transitional age. I'm working a lot more at the moment with kind of years 5, 6. We're doing along with a kind of youth project, we're doing a kind of faith conversations, but also in regards to all the kind of transitional feelings children have from going from primary school on to secondary school. So we're kind of doing a kind of week with all the different schools in our area, just having various different resources and different bits of information and different kind of exercises and stuff that we're going to do. And I just, like anything else that would be helpful, I'm a youth mental health first aider, but I would love to get more involved on the suicide prevention side as well, really.
Well, I'll let the panelists think for a moment if there's anything that they want to share with you, but I can tell you that we have a few things that might be of huge interest. So we have a free to download document called Planting the Seed, which takes a seed. We use a sunflower seed, but you could use anything. And it looks at all elements of the curriculum and explores how we grow that seed so it can flourish. But the backdrop of the whole programme is, what do you need to flourish? So we use this as a symbol. What does this plant need to grow and survive? And what do you need? So it's all there, free to download, but we also have longer sessions that we bring into schools and we travel around delivering that. We also have, and Joe leads on this actually, is our transition talk from year 6 into secondary school. We're teaching whole year groups. And it's something that where we start, we have 60, 90 kids in the room saying they're nervous, they're anxious, some are not sleeping well. They're not doing great in relation to the thoughts they're having about transitioning from primary to secondary. But in one short hour, we take them through a process that allows them to feel very much calmer and in control. And that's exactly what they say at the end of the hour. We feel more content, we feel calm, this no longer feels like a big issue. And we can share more about that with you.
That would be amazing.
If you would like.
Yeah, thank you.
We will be delivering, although we deliver, I was going to say,
sorry,
Lucy,
I'm so sorry.
I was just going to say we are going to do an open session, so Joe and I will be delivering that after Easter. And Joe, maybe we can make a note to make sure Lucy knows about it.
Yeah, I've written Lucy's name down and I'll drop you an email, Lucy, and we can chat
Thank
more.
you so much. I really appreciate it. Thank
No
you.
worries at all.
And in the meantime, I think Sandeep has something to add.
Thank you very much, Debbie. Really, really good point there, Lucy. And I think it's one that's often neglected, if you ask me. And it's great that you are shining the spotlight there, because that transition is so crucial, so crucial for young people. So how I can potentially support is I've done talks in schools for quite some time, more so obviously pre-COVID. And I worked collaboratively with coaches, and we focused on things like emotional well-being and bringing it to their level, the young people that were in the room. So what I did was back-to-back assemblies for years, for the year group through that week. And then we ended the week with a more bespoke workshop, working collaboratively with the safeguarding officer and the school therapist as well, to identify those students that definitely need the support. And that's where we started to delve into emotional well-being and looked at various different workshops and interactive discussions to get them more involved in various different things. So I'm happy to speak on that side.
Yeah, that would be great. My experience of suicide was at that age, you see. So that I'm 40 now, but like at the time, and that was the time when I felt like I had a real disconnect with my faith as well. So I'm kind of wanting to merge the two in the work that we do. And so it'd be really, be great.
Amazing. I've dropped my email in the chat. It'll be good to
thank you so much. That's fab.
No problem.
Lucy, I really recommend you reach out while they're still operating to the Luna Foundation. Actually, Anna Audley was on the call earlier, but Anna also was bereaved by suicide as a child, and the Luna Foundation is based on all of her work, having completed a Churchill Fellowship, and looks at and trains people to truly understand how to support young people. So check the Luna Foundation website. You might find lots of really interesting stuff on there for you.
Amazing. Thank you so much for all your help. It's really helpful. Thank you.
Well.